doing today?
I'm good. How are you?
I'm good. My name's Megan. I'm going to be your occupational therapist for today. Are you familiar with what OT is?
Kind of, yeah.
Oh, awesome. Well, what we're going to do today is we're going to help you learn about your daily activities and what you like to do, hopefully get you back to the highest level of independence as possible. So I know you just had your hip replaced, and we're going to go, and I'm going to help you put on your pants, because I know that the doctor told you that you have some non-weight-bearing restrictions on your hip.
I do.
Did he explain that to you?
Yeah.
Are you familiar with what they are? Do you have any questions?
No.
No? Alright, so what we're going to do today is we're going to just make sure that our hip doesn't raise between 90 degrees, so that would be all the way up here. We want to make sure that you don't lean forward when you're reaching for anything, or you can't reach down to grab your pants. We also want to make sure that we don't internally rotate our knees in or our knees out at all. We want to make sure that our toes are facing forward, nice and straight. And also, we're just not going to put any weight in this foot. So I'm going to help you out with my gait belt, but I also want to make sure that you're lifting off of this leg. Sound good?
Mm-hmm.
Awesome. So I'm going to have you grab your pants, and I'm going to have you place the tie facing up on your lap. Perfect. Now if you're holding right there, I'm just going to place this gait belt around you just for safety in case you feel a little bit unsteady. How are you feeling today so far?
Good. Thank you.
Good? Wonderful. You don't feel dizzy at all? Out of breath?
Not yet.
Perfect. If you feel that at all, just let me know, okay? And we'll stop. We'll take a breather.
It's nice though.
Yeah, isn't it pretty? All right, does that feel okay? Is that too tight?
No, it's good.
Perfect. All right, so I'm just going to go through this with you for a second. I'm going to help you put them down on the bottom of your feet, but what we're going to do is we're going to dress our affected side first. We're going to put our foot in, and I'm going to help you lift it up to about your knee, and then we're going to reach down on our other side that's not affected, because we don't have any restrictions on this side. We're going to reach down and grab them. So I'm going to grab these from you first. I'm going to bunch them up all the way down at your feet, and I'm going to help you place your foot inside. All right, so when you can grab that, you let me know, and then now we're going to lift up this leg, but make sure we don't put this at 90 degrees. Okay, so let's try and put this leg in there. Perfect. See, that one didn't go past 90. And then you can just shuffle it up on your toe. All right, and now I'm going to move your walker over, and we're going to stand up. Now we want to keep in mind that we're not going to put any weight on that left leg. And your pants should stay over here. I'm going to have you reach forward with this hand, please, and you're going to grab this, and we're going to push off the table using this. On the count of 3, just stand up on your right leg. 1, 2, 3. Perfect. All right, now you can help pull up the rest of your pants. Awesome. You feel stable? You feel good? All right, now I'm going to have you grab onto your walker again, and then we're going to reach back with this hand and sit back down nice and slow. Perfect. That was great. How do you feel?
Good.
Awesome. So we really want to work on independence with our dressing, because we're going to be at home alone. You don't really want to depend on your family members all the time. So next week on our session, we're going to work on using a reacher and maybe a shoehorn, because we want to be able to dress ourselves completely from our lower body with our precautions, because it's going to be a little while until we can dress. So I'm going to bring a reacher, I'm going to bring a shoehorn, and we'll practice that. So today we did lower body dressing with our hip precautions. Do you have any questions?